I'm Raj Dave at C3 2018 in Orlando, Florida. And I'm here with some very distinguished guests as well as a special announcement. To my right is Dr. Fayaz Shawl, who is Director of Interventional Cardiology at Washington Hospital Center and also one of the great pioneers of interventional cardiology, and who has done first angioplasty in military hospital in 1981. And it's a great honor to have you, Fayaz, here today.
Thank you, Raj. It's truly an honor, and I'm privileged to be here.
To my left is Dr. Magdi El-Omar. He's a consultant interventional cardiologist at Manchester Hospital in UK. And also welcome Smriti Saraf, who is also now a newly joined staff consultant cardiologist at Manchester Hospital in UK as well, who is graduated from fellowship program in Manchester and now functioning as an interventional cardiology. So this year C3 has tremendous lineup of legends and luminaries, and we go through a tremendously vigorous process to select our legends and luminaries, and it's my great privilege and honor to have Dr. Fayaz Shawl getting the Legend Award this year at C3. Fayaz, congratulations.
Thank you, Raj. It's truly an honor.
Absolutely deserved, and it's a well due for quite some time. We've been thinking about Fayaz's name for the last couple of years, and it's really a fantastic, perfect timing of the tremendous growth of the meeting and your award at the same time, so it really fits. Along with that, I'm going to make another exciting announcement of the Fayaz Shawl Scholarship in Interventional Cardiology, which is a new fellowship that we are starting as of this year, which is at the courtesy of Fayaz Shawl Foundation out of Dubai. And Smriti actually is one of the recipients of the Fayaz Shawl Interventional Cardiology Fellowship. So before I talk about that, I want to ask a few historical things to Fayaz. Fayaz, we've been through a tremendous journey in interventional cardiology space. You've been there from the inception of it. So tell us a little bit about how the history of intervention has evolved, where we have been, and where we are going.
Well, thank you, Raj. First, I really want to thank you for including me as a legend. There are so many legends in the world, but it's truly an honor. Now, going back, what is amazing is that I was a second-year fellow at Walter Reed Army Medical Center, and I heard Andrea Grunzig is teaching by live demonstration in Zurich. It was his last course in 1980. And I asked my chief of cath lab and the director of cardiology, I'd like to go there. They said, "You're kidding. What is the balloon angioplasty?" They did not know about this. But anyway, I couldn't afford to go to Zurich. So what I did is, being in the Army, you wear your fatigues, and I went to Andrews Air Force Base, hopped a C3, called C3, Air Force cargo plane, and then I arrived at Frankfurt, and from there, I went to Zurich and watched Andreas doing live cases. And in fact, it was 1980, but the first PTCA was done by him in 1977, the birth of truly interventional cardiology. And I think ever since that first PTCA, I would have never thought in 1980 that we'll have a meeting in interventional cardiology. And to be honest, Raj, I'd like to congratulate you because I have been coming here for the past 14 years, and each and every year I go back and learn something. So when you asked me to support the scholarship to bring fellows like Smriti to this meeting, I said, well, if I can learn each time I come here, fellows is like a sea of knowledge here. So I'm really glad that you have been doing these meetings, and I think it's probably, having been around the globe, one of the best meetings, and I learn each time, and I thank you for getting on in this every year. It's a tremendous, tremendous hard work to get meetings like this in action.
Thank you very much, Fayaz, for those very kind words. Thinking of education, and Fayaz, you've been involved in fellows education for so long. and we constantly sort of innovate and evolve ourselves in how we can get our fellows more trained. And I really want to give a huge accolade to Magdi El-Omar, who's really selflessly has tried very, very hard to help a lot of UK physicians. So for last several years, Magdi has been running a competition in UK with the best abstracts and cases, and we've been inviting those fellows to C3 meeting. So Magdi, talk a little bit about your experience with the trainees in UK, and then I also want to talk about our new publication.
Sure, absolutely. So first of all, we're really privileged to be associated with C3, and without the support that you have given us, meaning to the British contingency, if you like, and now, of course, Dr. Shawl, none of this would have been possible. So thank you for giving us that opportunity. But I think, of course, fellows coming here, they can learn a lot. They can attend sessions, get updates, and learn new stuff. But also should also have the opportunity to interact meaningfully with what's going on, and that means presenting something, and a case presentation, an abstract, a bit of research, and so on. That would make that does make the experience a lot more worthwhile for them. So what I envisaged in terms of who to bring here was to make the whole thing a little bit more competitive than just 10 available sort of opportunities, 10 slots, 10 jollies, if you like, come to Orlando and so on, and go to the conference. We wanted to make it a bit more competitive. So what I've done is to basically mastermind the advertising of this fellowship opportunity or this opportunity via the British Cardiovascular Intervention Society. And then invite applications for these slots, and then recruited some really high up people in the BSIS hierarchy to shortlist the candidates based on 3 criteria. So one of them is the strength of their CV, 2 in terms of publications and where they trained and so on, 2 their intervention experience to date, and thirdly what they want to present. So we grade them, we give them marks out of 10 for each one of these 3 categories, and then we see who the top 10 people are, and we've had tremendous response. Each year we've had up to 40. I know it doesn't sound in absolute terms like a huge number, but actually it is a big number in terms of SPRs, trainees, interventional by UK standards. So we take the top 10, sometimes the top 15, and then offer them this opportunity on the proviso that they're coming here to actually present this, and the feedback has been tremendous.
So Smriti has been here for 3 years, and she's been the recipient of this, and you always have presented great stuff. What's your experience has been at this meeting?
First of all, thank you to Professor Shawl for allowing me to attend this year again. It's been a great privilege to be here. So I've been here for the last 3 years, and it's been an absolutely fantastic experience every time I've come here. I've attended the meeting, and it's great to update yourself in different fields of not just coronary intervention, but structural intervention, peripheral intervention, and vascular intervention. And not just that, it's an opportunity for trainees to showcase their work, to present the research they're doing in the universities and institutions, and also to network with very eminent people from around the globe. So it's been an absolute pleasure to be here throughout the years.
Well, sitting next to Dr. Shawl on the same stage, we can't make this any better.
Well, you're kind. Smriti, what was fascinating is when I started intervention in 1980 in Army, I left there and came to the present hospital, Washington Adventist Hospital. What I did those days is I brought people from India and other countries to come and not only scrub, just watch us, and taught, lots of people. And because I always remember how I taught myself. I didn't have any teacher, but just as Richard Myler one time said, you see one and do one, and in his own words, he said, have one.
Yeah.
But going back, I think there's a sea of things to look, and I at Washington Hospital, where I've been since 1980, has been my tremendous support to support people from overseas so that they can come and watch us at Adventist and then go back. And then I go and help them out. And now you have a ready-made recipe like C3, which is phenomenal. As you said, I I've been coming for the last 15 years. I don't know how Raj can put this meeting all together. It's phenomenal. I mean, right from, as you said, from peripheral intervention to venous to structural, coronary, is phenomenal meeting.
It's comprehensive. One thing that I do wanted to add is that, you know, it's great to have, you know, fellows, the and young physicians to present, but now we're going to also, you know, take the scientific level of this meeting to the next level. And recently we have been able to do a collaboration with a journal based out of Europe called Heart International that Magdi El-Omar is the chief editor of, and I will be the co-chief editor of that journal. This journal will publish as of next year all the scientific abstracts which are presented at this meeting, which is an index in the PubMed, and it's going to be an additional advantage to bring your latest science to this journal. We are also going to significantly expand the editorial board and sort of give the rebirth to this journal. And I'm going to reach out to folks like Fayaz Shawl and many other leaders in the field to be contributing to this new academic initiative that the meeting will add to already existing several fantastic opportunities that the meeting provides. So thank you very much, gentlemen, for your time. It was great to have you, and enjoy the wonderful next few days in the beautiful city of Orlando.
You will indeed. Thank you very much.
Thank you, Raj. Congratulations for
Thank you.
this
Thank
your upcoming journal.
Thank
That's
you very
great.
much. Thank you.